Hello, this is Dr. Shemin speaking. We're going to discuss the parotid surgery which you're about to undergo. The week before the surgery, you should prepare yourself by not taking any blood thinners. I recommend a week. Some people recommend 4 or 5 days being away from all blood thinners such as Coumadin, warfarin, Eliquis, aspirin. All these drugs can prolong bleeding and thus lead to hematoma or hemorrhage after the surgery. Please clarify this with your cardiologist or your internist who has put you on those medications. But we prefer that you be off those medications for 4, 5, or 7 days prior to the surgery. The testing now for COVID should be undergone 3 days before the surgery, both the molecular study as well as the antibody studies, as we want to make it the safest environment for you. We want to make sure that you don't have COVID, and also all the staff are also checked for COVID. The night before the surgery, nothing to eat or drink after midnight. You may take a sip of water in the morning with your blood pressure medications. That's the only medications that we really want you to take the morning of the surgery. Any other medications should be clarified with your internist or the surgeon who is doing the surgery. In my case, we allow you to take that medication for your blood pressure. You may also take medication if you have severe reflux. Again, only with a sip of water the morning of the surgery. You should take a full shower and clean the area that night prior to the surgery. When you come into the hospital, you're going to be seen by the admitting nurse in the holding area. She will go over to make sure that the EKG, chest x-ray, the internist clearance notes are all in order. Following that, you'll see myself, then you'll also see the anesthesiologist to whom you may address questions about the anesthesia, including any questions about nausea after the anesthesia is worn off. You'll also see the nurses from the operating room. Following this, you'll come into the operating room, at which point the anesthesia will be administered. You'll drift off to sleep, and the next thing you know, you'll be in the recovery room. Now, the incision for parotidectomy runs in front of the ear and then behind. This area, you may have some pain, you may have a little bit of swelling in the area immediately after the surgery, but it's usually not too severe. In fact, patients usually say they have very little pain in the area of the surgery itself. Our rule is to keep that area dry for the week after the surgery, so you'd be going home either that same day or the next morning after the surgery, depending on your condition, depending on your particular insurance company, whether you're allowed to stay overnight. But when you go home, I prefer that you keep the area entirely dry for the week. In other words, you can take a bath from the neck down. Do not get any water on your neck. If you'd like to wash your hair, have someone help you by leaning forward in the sink and wash your hair in the sink. You can also use dry shampoo. 1 week following the surgery, if there are stitches that have to be removed, they will be removed, following which you will be using a special gel containing silicone, which you'll apply on the incision 2 to 3 times a day for 2 to 3 months. That will make sure that the incision fades. You'll likely never see this area in front of the ear. You may see this area behind, and that's why we definitely want you to use that silicone gel cream. For 1 year after the surgery, we would like you to stay out of the sun, at least to keep this area out of the sun, because the area will turn red if you have the sun beating down on it. For instance, when you go to the beach or if you go on a fishing trip. If you do so, if you want to go out, if you want to play tennis, which we encourage, you should put a sunblock over the incision line, especially, and that means like a number 60 or more sunblock factor. If you have any questions, please do not hesitate to call us at 212-472-8882. And also please visit our website, nyheadandnecksurgery.com. That's nyheadandnecksurgery.com. Thank you very much for your attention, and have a good day.